Hello, I'm Dr. Lipi, and welcome to my show, Health, Humor, and Harmony. Did you know that May is Lupus Awareness Month? Did you also know that this chronic autoimmune disease affects millions of people worldwide, including celebrities such as actress and musician Selena Gomez, singer-songwriter Toni Braxton, and television personality Nick Cannon? In today's episode, I'll talk about what lupus is, its effect on the body, how to treat it, and Selena Gomez's lupus journey, including organ transplant. Let's get started. So what is lupus? It also goes by the name of SLE, or systemic lupus erythematosus, or SLE. It's a chronic autoimmune disease that causes systemic inflammation of multiple tissues and organs. Autoimmune essentially means that your immune system, which normally protects you from infection and disease, is attacked by your own tissues. This attack can lead to permanent damage to many organs, including your skin, joints, kidneys, heart, brain, and more. Speaking of which, how does lupus affect the body? Lupus is often called the great imitator because it can manifest in so many different ways. It's often mistaken for different diseases, and it can be hard to diagnose. Common symptoms include extreme fatigue, joint pain and swelling, fever, mouth sores, hair loss, seizures, rash, a butterfly rash across the cheeks and nose, and more. Severe organ damage can lead to kidney disease or lupus nephritis, brain dysfunction, heart inflammation, myocarditis, and pericarditis, blood clots, psychosis, and more. So, can lupus be treated? Yes! The goals of treatment are to suppress the overactive immune system, limit flares, achieve remission, prevent permanent organ damage, and improve your quality of life. Medications include NSAIDs, non-steroidal anti-inflammatory drugs, to treat pain or fever, antimalarials like hydroxychloroquine to treat joint pain, rashes, lung inflammation, and reduce flares, corticosteroids to reduce inflammation, and infusion of biologics like rituximab. Selena Gomez's journey with lupus. While many celebrities have been affected by this autoimmune illness, singer and actress Selena Gomez has been particularly open about her journey, including a lupus-induced kidney transplant and chemotherapy.
An estimated 1.5 million Americans suffer from the autoimmune disease lupus. And while there's no cure, it is treatable with steroids and other anti-inflammatory meds.
This is my time to just kind of stop and say, this is my perspective on where I am.
Headlines popped up alleging the star was entering an Arizona rehab facility for drug or alcohol-related issues. Gomez now responding, saying, "I wanted so badly to say, you guys have no idea. I'm in chemotherapy."
Toni Braxton has written a memoir about her experiences with lupus. In her book, she discusses the challenges of living with lupus and how she also manages her symptoms while performing. None of these celebs, including Seal and Nick Cannon, have let lupus slow them down. They continue to work and maintain their careers while coping with lupus and continuing to raise awareness for this lifelong condition. On behalf of my patients and all of you, I am so grateful to these artists for their vulnerability, openness, and advocacy for lupus awareness. So how can you make a difference? Research on lupus is ongoing, and researchers are constantly working to better understand lupus and develop new treatments. It's important to note that lupus can be managed with proper care, as I mentioned before. With the right treatment and support system, many people with lupus are able to manage their symptoms and lead happy and fulfilling lives. here are just a few amazing organizations that you can learn from, donate to, or volunteer with, including the American College of Rheumatology, the National Institute of Arthritis and Musculoskeletal and Skin Diseases, or NIAMS, the Lupus Foundation of America, and the Lupus Research Alliance. Well, that's all for today. Here's your joke of the day, lupus themed. Why did the lupus patient get lost on the way to the doctor's office? Because they had a flair for directions. Be sure to subscribe to my YouTube channel, make comments below, and follow my Instagram at healthhumorharmony Dr. Roy. Be well. I'll see you soon.